Hola amigos, feliz viernes, hoy es viernes, yo soy Rory, estoy contento de estar aquí contigo. Hoy nuestro tema de conversación es la historia médica familiar en español. So today our topic is family medical history in Spanish. So what we're going to do, we're going to look at an example, then we're going to look at some vocab, and then we're going to put it all together into some frases que son muy comunes para ustedes. Some really common questions and phrases for talking about family medical history en español. Okay, let's get started with un ejemplo. Un ejemplo para empezar. All right, ¿sus padres están vivos? Are your parents alive? Sí, están vivos, pero no tienen muy buena salud. Yeah, they're alive, but they don't have great health. ¿Ellos toman medicamentos? Do they take medication? Sí, mi padre toma la metformina y mi mamá toma hidroclorotiazida. So yes, my father takes metformin and my mom takes hydrochlorothiazide. ¿Hace cuánto tiempo? ¿Hace cuánto tiempo? For how long? Su papá padece de diabetes. So for how long has your dad had diabetes? Y su mamá sufre de la presión alta. And your mom suffers from high blood pressure. Bueno, por muchos años. Well, for a lot of time. ¿Hay historia de cáncer en su familia? Is there a history of cancer in your family? No, nadie ha tenido cáncer, gracias a Dios. No one's had cancer, thank God. Okay, let's take a look aquí. Vemos algunas cositas. First of all, some frases that maybe would be worth noting for you as you go through and talk about family medical history stuff. Okay, estar vivo, sure. Estar vivo is just the way we say is alive or is living, right? Okay. Bien, ¿hace cuánto tiempo que? So this is an expression, I should have underlined it, but I didn't. This is an expression that isn't very English per se. There's not a great English equivalent or exact translation. But hace cuánto tiempo que literally means for how long. For how long. So hace cuánto tiempo que su papá padece de diabetes. Padece is possibly a verb you've never seen before, but it's the verb, it's padecer de, and it's the verb to have something chronically, okay? Y mamá sufre de la presión. This is a synonym of padece de. So sufre de, padece de, those are two common verbs to talk about having some sort of illness. You know, from our English perspective, we might just want to say tiene, like tiene has. But in Spanish, listen for padece de and sufre de. You'll hear it, okay? Bien. Hay historia de. I is a great word for you to know if you don't know it already. I is the verb there is, there are. When you put it in a question, it's no longer the statement, it's now the question. Is there, are there? Okay, bien. So, we've got padres aquí as some familia. Let's take a look at más familia, más vocabulario de familia. So, we've got la familia nuclear, or el núcleo familiar. Madre is the same as mamá. Padre is the same as papá. And then we've got hijo, hija is your child. Not just any child, but your child. Hijo, hija. Okay? Hermano, hermana, brother, sister. Y now we're going to head over to the extended family, but let me just mention something about hijo, hija. Niño is the word, niña is the word for just kind of any kid or child, right? But hijo, hija literally means nuclear family child, like your child, okay? Bien. All right, parientes, our family members, parientes. Abuelo, abuela, grandparent, so grandfather, grandmother. Nieto, nieta, grandson, granddaughter. Tío, tía, uncle and aunt. Primo, prima, boy cousin, girl cousin. Sobrino, sobrina, nephew and niece. And then we've got tío abuelo and tía abuela. This is great uncle and great aunt. Okay, bien. So we've got some vocabulario de familia that could come up as you're asking about family members and their illnesses. But let's talk about what are some of those enfermedades hereditarias, some of those hereditary illnesses. So we've got enfermedades de corazón. So any heart disease or heart problems, enfermedades de corazón. Arritmia. So arrhythmia, yeah. Ataque de corazón, a heart attack. Colesterol alto, so high cholesterol. Miopatía, so myopathy. Presión alta o hipertensión, both mean high blood pressure, basically. Okay. Insuficiencia cardíaca is heart failure. Now, failure in Spanish, there's other words for failure that mean like failing a test and failing at an objective or a goal or something. But in this case, in the medical case, failure is usually insufficiency, which is a good descriptor anyway. So, insuficiencia cardíaca. You could have insuficiencia pulmonar, so lung, insuficiencia renal, kidney, etc. Hepática, liver, okay? Bien. All right, enfermedades de sangre, some blood illnesses. So we've got anemia, anemia falciforme, so sickle cell, hemophilia, and then we've got some enfermedades mentales, adicciones, of course, adicciones, ansiedad, anxiety, y la depresión, depression, okay? Let's keep going. Más enfermedades hereditarias. So these are, kind of categorized. So we've got alergias, allergies, arthritis, arthritis, asthma, cancer, diabetes. Say it with me once, diabetes. When you look at it, you want to say diabetes, maybe, but it's diabetes, okay? Fibrosis quística, cystic fibrosis, obesidad, obesity, síndrome Down, so Down syndrome, enfermedad Crohn's, la enfermedad Crohn's, colitis, la colitis or colitis ulcerativa, so ulcerative colitis, hipotiroidismo, el hipotiroidismo, so hypothyroidism, hipertiroidismo, so hyperthyroidism, okay? Bien, so we've got a list of enfermedades hereditarias. You could add to this list with más vocabulario. It's not an exhaustive list. It's, a decent list, but not exhaustive. Let's talk about if you were to ask any questions about medications to your patients, are you taking this, or does anyone in your family take this or that? So, ¿alguien en su familia toma medicamentos? This is a great way to just say anyone in your family. Anyone in your family toma medicamentos? Does anyone in your family take medication? ¿Toma usted algún medicamento recetado? So do you take any prescription medications? So recetado would be our adjective prescribed, okay? ¿Toma medicinas no recetadas? So do you take any non-prescribed medications or de venta libre? Two easy ways to say like over the counter, for example. Toma medicinas no recetadas or medicinas de venta libre, over-the-counter meds. Usa algún tipo de crema? Do you use any kinds of creams? Usa gotas para los ojos? Gotas para los ojos, so drops, yeah? ¿Cuáles productos nutritivos or suplementos usa? So what supplements do you use? ¿Cuáles productos nutritivos or suplementos usa? ¿Cuáles productos naturales, hierbas o productos dietéticos está tomando? So it's interesting that these questions are formatted in a way that just kind of assumes that your person's taking something, right? Your patient is taking something. We've heard from a lot of folks in Latin America that are just like, you know what? It's just so common to be using certain home remedies and things like that, that if you... But it's also like a little bit, the patient maybe isn't sure what you'd think of it if you said, are you taking anything? And more of a yes, no. And so if you just assume that they are, then it becomes immediately just like accepted and you acknowledge it and that there might be some more openness to sharing what might be some home remedies. So try it out. It's worth a shot anyway. So the assumption being if you're asking, what are you taking? It just assumes that, or they understand that you assume you're maybe doing it and not maybe casting any aspersions on it, okay? Great. ¿Cuánto toma? How much do you take? ¿Con qué frecuencia los toma? So how often? ¿Con qué frecuencia los toma? Do you take them? So how much do you take? And then ¿con qué frecuencia los toma? How often do you take them? All right. Getting into questions specifically about the family history. ¿Alguien en su familia? Okay, we've seen that before. Anyone in your family. ¿Alguien en su familia padece de, suffers from, or ha padecido de, or has suffered from, ha padecido de alcoholismo, alcoholism, abuso de drogas, any drug abuse, Cáncer, cancer. Colesterol alto, high cholesterol. Derrame cerebral, a stroke, derrame cerebral. Enfermedades cardíacas, so any heart disease. Enfermedad psiquiátrica, so any psychiatric disease. Presión arterial, so just blood pressure, see? So if you say padece de presión arterial, then we know it's basically high blood pressure. Bien. Otras preguntas útiles, some other possible questions. ¿Qué enfermedades hay en su familia? So there's I again, that word there is, there are. When you put it in a question, it's is there, are there. So we're asking what illnesses or sicknesses are there in your family? A very open-ended question. Hay historia de, now we're bringing it down and being very specific. Hay historia de, is there a history of? Hay historia de colesterol alto en su familia, cáncer en su familia, diabetes en su familia. Está vivo su, we've seen this one too. Está vivo su abuelo was how we first started this lesson. No, it was padres, I think. But you could ask that question and throw in a family member there. Está vivo su mamá? Excuse me, in that case it'd be viva su mamá or vivo su papá. ¿Cuántos años tenía cuando se murió? Okay, ¿cuántos años tenía? It's a past tense. How old were they cuando se murió? When they passed, when they died. ¿De qué se murió? What did they die of? ¿Qué enfermedades tenía? What illnesses did they have? Okay. ¿Alguien en su familia ha tenido? ¿Alguien en su familia ha tenido? This is has had. So essentially we're asking the question, has anyone in your family had? ¿Alguien en su familia ha tenido presión alta, cáncer, whatever it might be? Okay? All right. Think back to el vocabulario. If you're watching this on the blog post, make sure you download the notes so you've got the vocab in front of you. In fact, if you're learning something right now, make sure you like this video, subscribe to our channel, and that helps us continue to be able to do this on a weekly basis. Okay, let's get to some práctica, some vocabulario aquí. So thinking of family members here, ¿quién es el papá de mi papá? El papá de mi papá. The father of my father. What's the vocab word for that? El abuelo. Sí, abuelo. All right, let's try another one. ¿Quién es la madre de mi primo? La madre de mi primo. So the mom of my cousin. ¿Quién es la madre de mi primo? Think family tree here. En español, la tía, aunt. Okay. ¿Cómo se dice heart failure en español? Remember? Failure was something for other cases, but for the medical case, failure is insufficiency, right? So it's going to be insuficiencia cardíaca, insuficiencia cardíaca. ¿Cómo se dice mental illness en español? Mental illness en español. Enfermedades mentales, enfermedades mentales. ¿Cómo se dice allergies en español? Allergies? Alergias, alergias. ¿Cómo se dice stroke en español? We kind of went through this one pretty fast, but do you remember it? Derrame cerebral, derrame cerebral. ¿Cómo se dice is there a history of en español? Is there a history of? Is there a history of? Hay historia de, is there a history of? All right, and ¿cómo se dice has anyone in your family had blank en español? Has anyone in your family had? ¿Alguien en su familia ha tenido? Has anyone in your family had? All right, and then una última pregunta aquí. ¿Cómo se dice how old was he or she en español? How old was he or she? ¿Cuántos años tenía en español? Okay, ¿cuántos años tenía? Okay, bien. You know what? We can't finish on odd numbers. We have to finish on an even number. Número 10. ¿Cómo se dice obesity in Spanish? Obesity. Obesidad. Obesidad. All right. Muy bien, muy bien. Preguntas. If you've got questions, be sure to post them down below here, whether you're watching this on YouTube or over on our blog post. Make a comment down below. If you've got some questions, we'll be happy to answer them for you. And if you need a conversation partner, someone to practice some Spanish, maybe go through family medical history with, just practice speaking, reach out in the Learning Medical Spanish Facebook group. Head over there and put yourself out there. Say, hey, I'm looking for a convo partner, and someone will certainly figure out what your schedule is, and you guys can connect and have some práctica conversando. All right, amigos, that's it for today. Gracias por aprender español conmigo. Juntos mejoramos comunidades. Para más español, head over to Common Ground International. And si quieres tomar un examen de español médico, head over to Certified Spanish. You can create your free account there and take as many free medical Spanish terminology tests as you would like. Muchas gracias por aprender conmigo. Nos vemos la próxima vez. Chao.